quizzer, I would say. Don't ask me how I know him that. He's been doing a lot of quizzing and he's been winning them as well. And he's done fantastically well. And his All India rank is rank 4. Congratulations, Dr. Lalit, for your grand success.
Thank you so much, sir. Thank you so much. It's really an honor, sir, to be here with you, sir.
It's my pleasure, Dr. Lalit. So Dr. Lalit has done his PG from, Dr. Lalit, can you share your background, where you did your UG from and the PG from?
Yes, sir. Sir, I did my UG from Medicity Institute of Medical Sciences in Hyderabad. Then I went on to do my PG from Maulana Azad Medical College, Delhi, sir. And now, sir, we're here.
So let me ask you about your preparation method. Dr. Lalit was our question bank subscriber, and he also appeared for the grand test series, including the image based, which the experience he probably himself should be sharing how it went through. But very importantly, Dr. Lalit has been preparing initially, as he told me, for gastro for a month before actually it became very clear that the subject is going to be a common question bank rather than a specialty based test. So how did that transition come, and how did you prepare, Dr. Lalit? If you can help the next generation coming as to what the preparation strategy should be.
Yes, sir. Sir, so I would say, sir, my preparation basically started from my MD days, sir, I would say. Like studying during the MD was more fruitful in this exam because we did not know the pattern and everything was just haphazard, sir, until the last minute. So, sir, during the MD, whatever we had studied, whatever notes we had taken, or Harrison's, especially Harrison's is the basis, sir, for this entire exam, I would say. So our basis of that helped a lot. So then along with Harrison's, now when the exam pattern was announced, then we need to focus on some specific things, sir. So for that we need MCQs, and there was no better source for MCQs than DocTutorials, I would say, sir, for us, because they had some basic level MCQs, they had advanced level MCQs also. And after doing one topic, I think it was wise we do the MCQs, then we can etch those things in our brain even more, whatever we have read, and it helps us to retain it, sir, for longer.
So I think that's a very important thing that Dr. Lalit has mentioned, a long-term memory and how you improve upon it with a short-term memory. Long-term memory is what you started in his residency, and that he just had to brush up through the DocTutorials question bank, which is what we've been hearing to all the successful candidates. They all are full praises for the question bank that we have, extremely exhaustive. And each faculty, like cardiology, I contribute questions, and neurology, Dr. Rahul Raji will contribute. So that's how the questions come. And then we try to dig up questions, and we are told by DocTutorials not to repeat a question. So every time we contribute a question, it's not a repetitive one, and we try to dig out through the Harrison and then take out questions from the lines that. So that's a very valid point, that the question bank is pretty much helpful. I remember that you also appeared for your grand test, and actually he was second All India in the grand test, and he has mimicked his result nearly, I would say, in the All India ranking as well. So your experience with the grand test, Dr. Lalit?
Sir, it was good, sir. I would say it was actually similar to our NEET exam, sir, because there was a lot of infectious diseases in that grand test, I remember. Yes. And we were not expecting that. So that helped us to at least focus somewhat on infectious diseases and these topics which we wouldn't expect. We usually focus on the main core branches, sir. We don't usually focus on these other things. And there were a lot of infectious diseases in our thing. So the grand test did help a lot.
Yeah, so I think this time the big surprise in the paper was the genetics and the infectious disease. But look, people have been saying that cardiology, neurology was not weighing. When I went through the paper, actually they contributed still 1/6 each. 1/3 of the paper was still cardiology, neurology. If you actually include nifedipine as a drug from cardiology used for high altitude pulmonary edema. So if you count all those kind of a question, I think there were 20 to 25 questions from cardiology and almost 15 to 20 from neurology. So that would still amount to. So would you suggest that probably now things are moving more towards generality in terms of preparation, or you still need to focus on your specialty subjects? Like I'm sure you were appearing for INI SS also for your gastro, because you were too dedicated for the branch. So do you think you should, the next generation should focus one specialty book of, say, gastro if you want to do, and also stick to Harrison, or just stick to Harrison and focus on NEET SS?
So this is based on interest, sir. Some people usually are interested in one branch from the beginning of time, sir. So for them, sir, I think you can focus on a specific book, and definitely you have to do Harrison, sir. There's no There's no skipping it at this time, because even the NE exam, I think this time 30 questions were from medicine itself. They have increased the portion in NE also, sir. So the base knowledge of medicine is definitely required, sir. And if we're targeting needs, then it is definitely entirely general medicine, sir, right now, because the paper is not going into depths of the specialty. It is going at a superficial level, I would say, sir.
True. And do you think still the couple of important topics still hold on to play a lot of important role in the number of question, what I call a high yield topics? For example, it's always known, when I was doing even a grand revision, I knew that GAP is going to give you 4 or 5 questions. Again, you had 3, 4, 5 questions.
Yes,
and Dr. Lalit shared a very interesting story before we started, that he saw the video of JVP, which is a free video on DocTutorials after the exam, but he still did well. So I mean, of course, he's brilliant chap, so he did not probably need that free video my side. But do you think that still the high yield topics still hold a big key, despite the change in the mode of switching of how the questions are being raised? Did the high yield topics still hold on to in the weightage in terms of the number of questions that were asked?
Yes, sir. In the specialty, sir, the high yield topics were really important, sir. Like they asked JVP, they asked valvular heart disease. They were asking only specific things which were important. They did not go overboard and ask. They didn't even ask hypertrophic cardiomyopathy. So they were asking very important topics which are even important for our MD level exam. But the only thing which was outside, sir, were these genetics and infectious diseases. So those we cannot consider them as they're not important, but we just don't focus on them, sir, during our
I mean, if otherwise DocTutorials question bank would amount for everything, so that's the reason they would have to ask something to differentiate between a bright chap like you and somebody who's not so bright. So did you attempt all 150 questions, or they were?
Yes, no, sir. I attempted all. I felt that I was able to eliminate at least one of them in all, sir. So I just gave it a go because it was the +4 -1 scheme which we have had since the past. So I attempted all of them. I attempted one.
Yeah, I think this is something very important that's emerging. We were doing top 10 interviews. I mean, the guys and DocTutorials has got more than 60% strike rate in top 10 this year, and everybody is talking like this. I mean, everybody's saying that yes, their attempt rate was nearly 140 to 150. So this is one important message. If you actually are looking at a big success, the elimination method that Dr. Lalit has talked about, if you're sure that either of the two is correct, I think you can surely take a hit on it and hope for the best and keep your fingers crossed that the rule of probability will not be falling against you, and probably out of 4 chances that you take, at least 2 of them is going to come turn right, and you're actually going to get more marks.
It will always be positive, sir. It will not be a negative thing. Yes, sir.
Right. So I think it's a time for you to go back to Delhi, or you're staying back to your home at Hyderabad?
Yeah, so mostly I would like to go to Delhi, sir. As there's no bond, sir, in Delhi, there's an advantage. We don't have to have a bond here in Delhi.
Right.
And the institute, I think, for gastroenterology is really good in Delhi, sir.
So there is a news that your bond policy may become universal. Let's see how the matter is also sub judice. So maybe we can have one session on that. If they, in that case, probably they're going to come up with a universal policy. Fingers crossed. Maybe this year, maybe or the next year. In which case, it will be universal bond across the country, in the sense that everywhere it will be like 1 year or whatever amount, or 2 years or whatever amount. That's going to become universal. That's the proposal by one of the state governments to the center, and let's see how the things roll out. If that is the criteria, then you should reconsider, and then I'll be happy to guide you on that as well if I have any. So let's keep connected. So it's a pleasure, Dr. Lalit. Thank you very much. So what is your take on DocTutorial question bank? Because I can ask you that, and grant test, and the image-based questions that you did to the next generation.
Yes, sir. The question bank is very extensive. I think it is very good. If we are studying Harrison, I think the best way would be to study a topic in Harrison, study a chapter in Harrison, and then do the questions based on this from both the basic module and from the specialty based module, and that will be it helps us remember a lot, sir. And then for the image based questions, sir, they were really good, sir. There were some really good images, and it just helps us to improve our memory. I think it's a good thing. There were some image based questions in our NEET also, but yes, sir, it is useful. It is definitely useful, sir. And as for the grant test, sir, as I said, sir, it helped me realize the importance of infectious diseases and some other chapters. So it was a good, and it clearly displayed how it is in the real life scenario, sir. The ranks are similar. They were predictive, I would say, at least for me, sir. So that would
True.
be, I think.
So I think it's a time for you to celebrate with your family. Have a good time.
Yes.
And let's stay connected the way we were connected before you cleared the
Yes.
exam, and now that we have connected after you cleared the exam.
Yes.
Always a pleasure, and it'll be looking forward to be of any help from my side and as well as from DocTutorials in your future as well. If we can be of any help or to guide you, it'll be our pleasure.
Yes,
Dr.
sir.
Lalit,
Thank you
it
so
was
much,
pleasure
sir.
to have you for the interview session today, and I wish you all the best. Take care and have a lovely weekend. Take care.
Thank
Bye-bye.
you, sir. Thank you so much, sir. Thank you.
Bye-bye.